Good morning, everyone. This is Sarah Willey with Miller Johnson, and I am here this morning with my colleague, Tripp VanderWal. We are here to talk to you about COVID-19 vaccine considerations. I am going to be talking to all of you first about the employment side of things, and Tripp is going to talk about coverage of the vaccine by group health plans. If some of you haven't yet met Tripp, he specializes in employee benefits, which I appreciate every day because he is my go-to person anytime I have an employment concern or issue that involves benefits. So I'm so pleased he's here with us on this Friday morning as well. I can tell you guys that you have spoken loud and clear in that everyone wants to know today about whether the COVID-19 vaccine can be mandated or not. As many of you probably know, we've got, we ask whether our attendees have questions when they sign up, and I'm not sure that I've seen quite a remarkable response in this way and a singular question that comes to the surface. So I promise you we are going to be answering that question today. To do that and to speak a little bit about it, I am going to start with explaining a bit about the timing and the availability of the vaccine, and also what this emergency use authorization means. And then we're going to talk about considerations for mandating it. Just as a teaser, though, the short answer to your question about mandating the vaccine is likely yes, with some exceptions, and noting that we probably still will be obtaining a lot more information about that question. As Tripp and I were preparing for the webinar today, it really became apparent to both of us that what we are calling a two-part vaccine series is not really going to be a two-part vaccine series. I think we're going to be back again at least a couple more times, updating all of you and giving you more information about the vaccine and what it means for your businesses. So with that, let me jump in. I'm sure you guys are here today because you've heard there is a vaccine coming, and it is coming in the very near future, perhaps even next week. What fantastic news. And by the way, I just have been looking so forward to the day when I could help with a webinar about the COVID-19 vaccine. So I'm just thrilled. So there is not one vaccine, if you haven't heard. There are actually now 4 vaccines on the slate to likely receive approval from our federal FDA for use, okay? The first 2 are the ones you've probably heard the most about. Those are by Pfizer and Moderna, and those are likely to receive what's called emergency use authorization next week, December 10th. That is next Thursday, you guys. And they are saying that once that occurs, the vaccine could be administered as soon after that as feasible, could be the next day, okay? There's also a vaccine by AstraZeneca that will likely receive approval in January. And now we also have a vaccine by Johnson & Johnson that will likely receive approval farther along in the spring, March or April of 2021. Interestingly, the Johnson & Johnson vaccine is a 1-dose vaccine, not a 2-dose vaccine, okay? So what does that all mean? The first thing that's very important to understand is all of these COVID-19 vaccines are government allocated, okay? And that is not like we have come to know the use and administration of vaccines, right? Usually we have healthcare organizations that buy them directly from drug companies and are able to decide largely for themselves who gets them and when. That is not the case here. Our government is deciding where they go and who will get them. Of course, what that means for all of you is you don't have those choices, okay? So employers have very limited access to the vaccine, and employers, as of now, have absolutely no control over who gets them, namely whether the employees in your workplace or in your four walls get them or not. Okay, the government is making those decisions. And by government, I mean the CDC has put together a roadmap to implementing the vaccines and is working collaboratively with the states and a number of other jurisdictions to make those decisions, okay? And Michigan also has its own COVID-19 vaccination plan. If you're bored this weekend, that is on the Michigan Department of Health and Human Services website. It's called Michigan's Vaccination Plan, and it actually is quite interesting, okay? So when we think about timing, right, when might this vaccine be available to your employees? The CDC and our Michigan Department of Health has decided who will get it, and they're using a phased approach, okay? So the CDC's recommendation is that in the very first phase, which the CDC is calling phase 1A, healthcare providers and long-term care facility residents and perhaps staff would get it. And the next phase, the CDC is recommending that certain essential workers get it. Now understand, the CDC is defining that more narrowly than all critical infrastructure employees. They're defining it as those in the education sector, utilities, first responders, police officers, et cetera. And then the CDC is recommending after that in phase 1C, certain people who don't necessarily work in those industries but fall within a demographic might get it. So adults with high-risk medical conditions and adults who are 65 years and older, okay? Important to understand, the CDC's recommendation is that healthy adults and children will not receive the vaccine until at least phase 2. Okay, so healthy adults and children that don't work in one of those special jobs are not going to get it until pretty far down the line. And as we walk back the timing here, that is probably going to be sometime in mid-2021. Okay, we think that's maybe May or June-ish. So for those of you who are on the call that have businesses that aren't in one of those critical infrastructure areas, this decision about mandating the vaccine is something that you're not going to be making likely next week. You are going to be making that decision months down the line, And we will likely have a lot more information at that point that's going to help you decide, okay? Let's talk a minute about Michigan's vaccine plan, because it's, as I mentioned, the CDC is working collaboratively with states like Michigan and is requiring those states to then come up with their own plan. And it looks like the technicalities of Michigan's plan are just maybe a little different, and or there's a bit more meat on the bones for us to understand. So under Michigan's plan, the very first allocations of this vaccine are going to be sent directly to hospitals and hospital systems exclusively for healthcare workers, okay? And I know, because I've spoken to some of them, our hospitals and hospital systems here in Michigan already know exactly how many doses they're getting, and they may have those in their hands next week, which is just absolutely incredible. And they are deciding who's going to get them. Based on the information I'm seeing, largely even those employers, our hospitals and our hospital systems, aren't having to make a decision about mandating the vaccine at this point, because the very first allocation is not going to be enough to vaccinate every single one of their healthcare workers anyway. Okay, so it appears that many or most of them are starting with an approach of identifying who is most at risk for exposure to COVID-19, assessing those who are wanting to raise their hand, and the vast majority of those folks are desirous of taking the vaccine for obvious reasons, and so they are not thinking a lot yet about mandation. Okay, later allocations after this initial allocation are going to be managed by our local health departments. And they are then going to be establishing distribution sites. And those will likely be, again, in our hospitals, doctors' offices, off-site clinics, and pharmacies. So after this initial allocation, as you guys are wondering how you're going to get your hands on the vaccine, it's going to look a lot like our the COVID testing centers that you've seen, right, pop up over the last several months. Those are probably going to turn into, instead of testing centers, or maybe in addition to testing centers, COVID-19 vaccination clinics. Okay, so under Michigan's plan, they have a three-phase plan. That's what they're calling it. And in phase one, they are planning to make the vaccine available first to the healthcare workers who have potential for direct or indirect exposure to COVID-19, long-term care staff and residents, first responders, those over 65 who may be at high risk for severe complications of COVID, and then certain employees, again, of that critical infrastructure. In Michigan is focusing on water, light, power, and EMS workers. In phase two, Michigan identifies other employees in our critical infrastructure, specifically grocery and food distribution workers, healthcare employees who were not in phase one, other high-risk populations, and then if there's enough available, other critical infrastructure employees, the obvious one being manufacturing, okay? Now, of course, I don't have enough inside information to know exactly when those phase two employees are likely to have access to the vaccine, but it appears to me that would probably be, January, February, early March time period. And I know that's a big window, but just to give you an idea, it certainly does not appear that that's going to happen in December or early January. It would be in the time frame between that first phase that we're going to be rolling out now to get all of our healthcare workers immunized, as well as the people in nursing homes and long-term care and those over 65 with severe complications. And then phase 3, of course, is going to be the general population. That is going to be late spring when we see access to the vaccine being widely available. And that, again, is likely when many employers would be thinking about whether it makes sense to require everyone, all of their employees, to get vaccinated for COVID-19. So under Michigan's plan, after that initial allocation directly to the hospitals, the local health departments are going to work with employer groups, and they're going to try to form partnerships to assure that employers have a mechanism to obtain the vaccinations. So we should expect to see a lot more information coming out of that, I would guess, early-ish 2021. And I would expect to see our health departments be reaching out to attempt to have a coordinated effort with employer groups in your area to explain how best to make this occur. I could very well be wrong, but I think we probably are not going to see a COVID-19 vaccination program like we sometimes see a flu vaccination program in workplaces. In other words, I would be very surprised if we have healthcare providers coming into workplaces to give the vaccine. It appears to me that the vaccine is going to instead be available at outside clinics, again, under a more controlled environment. Now, the reason I say I could be wrong about that is some of the later vaccines, it appears that they don't require as stringent storage requirements as the Pfizer vaccine. So those may be more amenable to having on-site workplace vaccine distribution. But again, a lot of this is wait and see. We're just going to have to see how this unfolds. And the local health departments will be encouraged by our Michigan Department of Health to have clinics for employers that don't have a mechanism to vaccinate employees. So whether that clinic is on site or not remains to be seen, but they are going to be encouraged to have some sort of scheduled clinic for certain employers to send their people to get vaccinated. And again, those clinics are likely to be the same as our COVID-19 testing centers. Okay, so with that background, I'm going to take a deep breath and ask Tripp whether we have some questions that I can take care of before I jump more into mandation of the vaccine.
Sarah, we did just get a slew of questions, but before I ask you some specific ones, let me just, I think I can knock off a couple. We have a couple questions out there that I'm going to just be honest with you, as lawyers and not physicians or pharmacologists, we are not qualified to answer. So, for example, we have a question: if you've had COVID, do you need to take the vaccine? I have no idea the answer to that question, so I don't know if you have any opinions. Or commenting, there was another one on commenting on the approval process under the EUA versus the typical vaccine approval process. Again, I don't have any comments on that. I don't know if you do, Sarah.
So with regard to the first question, my comment is only, I'm not even sure the scientists know the answer to that one. In other words, if you've had it, you need to take the vaccine. They are still studying COVID-19. It's not entirely clear. I feel certain saying the CDC would probably say, well, just go ahead and take the vaccine because we don't know yet. It would take years of study before we answer that. With regard to the second one, I would direct folks to the webinar from yesterday, actually. We had a pharmacist on who explained that approval process in detail. So I'll defer to Elizabeth, please.
And that of course, is available on Miller Johnston's YouTube page.
Exactly. So what do we have that I might know something about?
Okay, and then we've got several questions that ask about education workers, so teachers. So I know you're going to get to that. So I think we'll just put those on pause for right now, since you're going to touch on that. Correct?
Yes.
Okay.
Yep.
Some other questions I think that maybe we can answer is, can the state of Michigan follow their own vaccination plan instead of CDC guidelines?
Yes. So it's my understanding that the CDC guidelines are just that, they're guidelines, and they've directed each state to come up with their own plan. States have submitted that plan to the CDC, and I believe the CDC will have approved it. So yes, Michigan can have, it's very likely that Michigan will have slight variations for their own populations regarding who will get it and when.
Perfect. Another question is, and I think this is for the general public, is not necessarily just specific to employees, is the vaccine mandatory, or will it just become available to those people in the different phases? So meaning, once we get into the phase that I fall in, do I have to go get it, or is that just when it becomes available to me?
It is not mandatory. Our government can't mandate us to take vaccines. So it just means that it's going to be available for those who want to take it. Okay, so now that doesn't mean, and we're going to talk about this in a minute, whether employers can condition employment on getting it is a different question, right? But the state of Michigan or the federal government can't tell us all that we have to go get something injected into our body if we don't want to.
Gotcha. And then the last one, and then I think we should move on, and I don't actually think this requires an answer now, is should we enforce a mandatory vaccine for our employees? And I don't think you need to answer that now, because I think that's what you're going to touch on next, correct?
Yes, exactly.
So that's a good segue.
That was a perfect segue. Thanks, Tripp. Okay, so let's talk about that then. Let's talk about vaccine mandation. And I know because I've lived with you all through the last, 9 months now, right, guys? 8 or 9 months. I fully understand why everyone wants to know, can we require our employees to get this vaccine? Because nobody wants COVID-19 to go away more than all of you. I fully understand it. So the first thing I'll say is just a reminder. This situation is unprecedented, okay? So we can, when we look at, from a legal standpoint, whether you can mandate the vaccine, we can look at what we know based on situations that have happened before. So, for example, we're looking at case law that involves the flu vaccine, okay? And that's helpful because it provides us some context, but we have no real precedent to speak to what is happening right now. We have no precedent that involves a global pandemic like the one we have now, and the level of death and the economic consequences of all of it. Okay, so we also don't have any context in the circumstance of vaccines that are under what's called an emergency use authorization. Okay, so that is the approval that the FDA is giving for these COVID-19 vaccinations. Okay, now understand that emergency use authorization by the FDA is still a very rigorous process and requires real case studies with individuals who took the vaccine, et cetera. So it is not an authorization that the FDA takes lightly. And the FDA fully recognizes that these vaccines are going to be given to millions, really even billions of people. But at the same time, the idea that these particular vaccines have an emergency use authorization rather than a full FDA authorization is something that we need to consider. And as part of that, and this is interesting, the federal regulations that speak to emergency use authorizations include a requirement that recipients have to be informed of the option to accept or refuse administration of the product. Okay, so that means when we have our employees get vaccinated, they're going to get that sheet of paper with all of the information on it. You guys are probably familiar with that when you've gotten the flu shot or other vaccines. And on that sheet of paper is going to be a statement that says you have the right to accept or refuse administration of this product. Okay, that could complicate things from a practical standpoint if you as an employer are mandating that vaccine for your employees. Now, you can still do it. You can still explain to your employees, well, that's not what that form says, because what we're saying is you do have to take it in order to keep your job here. But there's some communication then, I think, that probably you're going to need to make to your employees that you wouldn't necessarily have to make for the flu shot. The other thing that's unprecedented about this situation is to recognize that the vaccine currently has very limited availability. So for many of you, even if tomorrow you want to mandate it for all of your employees, that is not going to be possible for you right now. And also, it's unprecedented because you don't get to decide who gets it when. The government is deciding that for you. So again, even if you want to do it right now, you're not going to have control over which of your workforce receives it, okay? So for many of you, even I would hazard to guess the vast majority of you who are on the call, we are going to have a lot more information and guidance on this mandation issue before you have to make your decision. Okay, so with that, sort of my warning. With that, let's talk about what we know now about vaccine mandation, okay? There are a checklist of things that you need to consider, okay? So when I said the short answer is, sure, you can mandate vaccines, and that probably applies to the COVID vaccines like others, with exceptions. Here are the considerations or exceptions that we need to think about. Number one, both the ADA, the Federal Americans with Disabilities Act, and Title VII have implications. The ADA allows for reasonable accommodation for individuals with disabilities. Title VII allows for religious accommodations, and also the ADA has limits on medical exams, and we'll talk about that in a minute. The EEOC has issued guidance related to flu shots, but as I just said, flu shots are not the same as the COVID vaccine exactly. And they have not yet spoken regarding their opinion of the COVID vaccine and how those additional unprecedented factors color their opinion of mandation. I think they will. I think they're waiting to see for a bit. So we'll probably have more information on that. What else do we know? OSHA considerations. Okay, safety in the workplace considerations. And this cuts both ways, right? So requiring all of our employees to get vaccinated for COVID certainly moves us forward toward a safer workplace. If we can eradicate the idea of having COVID-19 in our workplace, that's fantastic from a safety standpoint. Of course, though, if some employees might have an adverse reaction or have side effects from the vaccine, then that is a different safety issue, okay? Again, OSHA's spoken about flu shots, and what they have said in the past is employers can mandate flu shots but are not required to do so. We might hear more from OSHA regarding the COVID vaccine as well. If you have collective bargaining units in your workplace, you absolutely need to be considering those in your analysis of whether to mandate the COVID vaccine. I'm not going to go into detail about that today. What else? I'm anticipating large pushback against mandation of vaccines in some workplaces. Why do I say that? Well, because we had pushback about people wearing masks in our workplaces. And so I think we're going to get pushback from people when we tell them that they have to receive a vaccine, particularly a vaccine that got emergency use authorization. And so remember, in the context of anti-vaccine movements, some of those could fall into the category of protected and concerted activity under the National Labor Relations Act. I raise that as something for you just to keep in the back of your mind and watch for that red flag if that is happening in your workplace, okay? And the last thing we need to think about are state privacy laws. Michigan does not have a privacy law like that would prohibit us from requiring employees to get vaccinated, but some states do have unique privacy laws. Okay, so if you've got operations in other states, you'll want to take a look at that. So that's my list. What I want to focus on, though, really today and talk a bit more about are those ADA and Title VII concerns, because those are really the overreaching considerations, I think, right now. So let's start with the ADA and the ADA's prohibition on medical examinations except under certain circumstances. So just as a reminder, the ADA says that we can only get medical examinations if they're job-related and consistent with business necessity, okay? Courts have said vaccinations are medical exams under the ADA. So in other words, under the ADA, we can only mandate the COVID-19 vaccine if it's job-related and consistent with medical necessity. There could be an issue with that if there were a colorable argument that the vaccine is not safe and effective. However, we feel pretty comfortable that the EEOC and likely courts would not buy that argument because they would defer to the CDC and the FDA's conclusion that the vaccine is safe and effective. Okay, so that's my long way of saying we think that it's going to pass muster under the ADA's medical examination requirement to mandate this vaccine, but just know there's a bit of a unique argument available because of the emergency use authorization status of the vaccination. The more relevant consideration, I think, under the ADA is this reasonable accommodation. Okay? We've got lots of experience with employers, primarily healthcare employers, who have been mandating the flu vaccine for years. Okay? And for those employers, really the two areas that they've had to focus on in their mandation programs are reasonable accommodation under the ADA and reasonable accommodation for religion under Title VII. So with regard to the ADA reasonable accommodation, remember, employees with ADA-covered disabilities can be entitled to accommodations. And in this case, they would request an exemption if they have a disability that prevents them from safely taking the vaccine. What that means for you is just that you need to be thinking about an interactive, reasonable accommodation process so that you are prepared to address those requests, because you will get them, I promise. So if you are an employer that is seriously considering a mandation program, you may as well start getting your ducks lined up now, right? And think through what sort of reasonable accommodation process do I want to already have in place so I am ready to go. And as part of that process, we can certainly require medical documentation to support the disability and the fact that they can't take the vaccine. And we would want to start thinking through how we're going to address those and what alternative accommodations we might be willing to offer. And remember, under the ADA reasonable accommodation process, exclusion from the workplace is always a last resort. So guess what we would be looking at? Masks, plastic barriers, protective gear, etc. In other words, it might be the case that as a reasonable accommodation under the ADA, we could require these employees to continue to follow these safety protocols that we already have in place, whereas their coworkers, if they've received the vaccine, might not have to, for example, wear a mask, social distance, stay out of break rooms, etc. Okay. And just as a reminder, under the ADA, we do not ever have to require or we don't have to accommodate a request for a reasonable accommodation if it would be an undue hardship to do so. So certainly it's highly unlikely that any of you would have to excuse somebody from taking the vaccine and allow that person to continue to work without additional safety measures in place, the employee wearing a mask, et cetera, because that would be an undue hardship in the context of this global pandemic. Okay, so lastly, let me just explain the Title VII religious accommodation. I think we've got a few more questions, and then I will turn it over to Tripp. So Title VII requires employers to reasonably accommodate an employee's sincerely held religious belief. And again, we know from our experience with mandation of flu vaccines, you should expect some of your employees to assert this. They're gonna go online pretty quickly and Google, can my employer make me take the COVID vaccine? And what's going to pop up is not if you have a sincerely held religious belief. Okay, and Title VII says we've got to accommodate that unless it would be an undue hardship. Under Title VII, undue hardship is a much lower standard, though. It's just got to be more than a de minimis cost. Okay, so there's no question that none of you are going to have to allow employees to be exempt from the COVID-19 vaccine and allow that employee to work without COVID-19 safety protocol in place, okay? With regard to the Title VII religious accommodation, the term religion is extremely broad and probably broader than what most of you might expect. It's any moral or ethical belief as to right or wrong, as long as that person sincerely holds it with what the courts say, strength of traditional religious views. So let's put that into context. Religious beliefs usually concern ultimate ideas about life, purpose, and death, right? It's philosophy, okay? but it's got to be more than a personal preference, a medical belief, or just their own philosophy on life, okay? It doesn't have to be widely practiced. So in the context of vaccines, the types of beliefs that have passed muster in courts are things like our bodies are a temple and God gave us dominion over our bodies, or injecting the flu vaccine into my body is morally wrong, or followers of my religion are healed by plants, fruits, and grains, obviously implying that the vaccine does not heal followers of that religion. So those are the types of things an employee can assert in order to fall under the Title VII religious exemption. We can require additional supporting documentation if there's no objective basis for if there is a basis for questioning the religion or whether the employee sincerely holds it. Of course, what that means and what documentation can be required is always tricky, particularly if it's not some sort of established religion. So bottom line with the Title VII religious accommodation piece is I'll be honest, guys, it's not all that hard for a bright employee to figure out what to say in order to fall into a religious belief under Title VII. And then the analysis really turns to potential accommodation and undue hardship. Now, again, get your process in place now. If you want to mandate the vaccine, your employees very well might not have access to it for a while, but if you are looking to get prepared for it, start thinking through what your process is going to look like. Okay, just a few other potential concerns regarding the vaccine. I'm going to turn to schools now and whether we can require students to get vaccinated. You know, it's interesting, this question is controlled by our Michigan school code, which caused me to consult with my specialist colleague, Kathy Tracy, who's a school lawyer, and she reminded me it's the Michigan Department of Health that decides which diseases are subject to an immunization requirement in Michigan. So we're going to have to wait for the Michigan Health Department to speak to this. I am sure they will as the vaccine becomes widely available to kids who would be attending school. Usually vaccines are required, or the confirmation of vaccines we ask for prior to the first enrollment in school and before entering 7th grade. If the Michigan Health Department decides that COVID-19 is going to be on the list of required vaccines here in Michigan, I'm guessing they would also make an exception to that, such that students would have to provide that confirmation now. I don't think that issue is top of list right now for the Michigan Department of Health. They're trying to get the vaccine out to healthcare providers currently, but I think we will see more. Just a last note, the side effects, let me back up. So I've had a few situations in which employees have been part of the vaccine trials, which has been quite interesting. And a few of them have had minor side effects, which is expected from the vaccine, but they've included things like a fever. So as your employees take this vaccine, just be prepared. They may have some minor side effects, and those minor side effects can include symptoms of COVID-19, which raises an interesting question. I can tell you from a medical standpoint, the Pfizer vaccine and the Moderna vaccine, neither one of them have the live virus. So if somebody takes the vaccine and has some side effects, they are not actually shedding the virus or contagious to anyone else. They just need to recover from those side effects. We'll see what happens there with Public Act 238, because technically if somebody has a fever, they're not supposed to work for 10 days. I would hope that we'll see some sort of exception made if the employee has documentation that can demonstrate that they're not actually contagious because they just have a fever because they took the vaccine. So just an interesting thing to keep an eye on there. So Tripp, why don't you ask me just one or two questions, because I've left you with much less time than I promised because I talked for way too long. So, and I apologize for that, but are there one or two that you think people need to know the answer to?
Well, yes, I think I got two questions for you. One, I'm picking because I'm biased. I'm interested to hear the answer. The other, I think will answer several people's questions. And so let's first talk about the one that several people asked about, and it has to do with the religious exception to getting the vaccine and documentation or proof. What will I guess first, will the employee have to provide documentation or proof of the religious exception? And if so, what type of proof will they need to provide?
Well, that is always an interesting question when we have these requests. And I will be quite honest, often that availability to require proof is meaningless because there is no proof if it's not an established religion, and we essentially have to take their word for it. I mean, we can make them sign a statement or something like that, but that is not requiring proof really, in many cases, is not going to be something on which we are going to stand in order to deny the request for the exemption, right? We're probably going to be in a much better position to say, I'm sorry, it's an undue hardship to give you the exemption than to say you didn't give us enough proof for it.
All right. And then the second question, which I think is somewhat related to the first, is if someone has not claimed a religious exemption from getting the flu shot, will they be able to claim a religious exemption from getting the COVID vaccination?
Oh, that's an interesting question. Potentially, sure, if they frame it the right way, or say that they just found this religion, sure. I wouldn't say that there's a strict rule that you had to have declared your religious exemption by a certain time, otherwise it's waived forever. But I would think that could be a consideration that might be relevant to whether the employee actually sincerely holds the religious belief. So with that, here's what I'm going to do, Tripp. You talk about coverage by the vaccine for group health plans, and if others have asked questions, I will type the answer while you're presenting, so that they can have those questions answered as well. Okay.
Absolutely, and hopefully you can advance the slides for me as well too.
I can do both of those
I'm going to ask you to do multitask.
Only because I've had 2 cups of coffee, so I'm ready.
All right, thank you, Sarah. So as Sarah mentioned, my name is Tripp VanderWal. I'm in our employee benefits practice group, and I am going to talk to you briefly about coverage of the the COVID vaccination by group health plans. And just to give you a quick snapshot of where kind of my presentation is going to go is, first of all, the way that the government is going to require that these vaccinations be covered is on the basis that it is going to be preventive care that's required for most group health plans by the ACA. The good news is for your group health plans, for those of you that have fully insured health plans, most of the burden with complying with this, or potentially all of the burden for complying with this mandate, is going to fall on the insurer of that group health plan. And if you're self-funded, you may fall a little bit more on the burden of that. The burden may fall a little bit more on you, but certainly with assistance with whoever administers your health plan. So a little background is on the preventive care mandate. Is non-grandfathered group health plans under the ACA, as you are probably likely aware, are required to provide preventive care on a first dollar basis. And what I mean by first dollar basis is not only do those preventive care items and services have to be covered, you can't impose participant cost sharing. So they can't be subject to deductible, co-insurance, or co-payments. For those plans out there that utilize a network, which I would say was most of them, the general requirement is that you only have to provide this preventive care on a first dollar basis when provided by an in-network provider. But that is, of course, under your assumption that all of the required preventive care items and services can be obtained through in-network providers. And the reason I want to set the stage a little bit on the preventive care mandate is just so I can highlight the differences with how it's going to apply to coronavirus vaccinations and other preventive care related to COVID-19. So what is, and generally, what are the required preventive care items and services under the ACA? And it's simply any evidence-based items or services with A or B rating by the United States Preventive Services Task Force, immunizations for routine use recommended by the Advisory Committee on Immunization Practices, and then evidence-based preventive care and screenings for certain individuals recommended by the Health Resources and Services Commission. So obviously, the preventive care items and services does not remain stagnant from year to year. There are changes. Sometimes service items and services are removed, but more likely, new items or services are added over time. And so that raises the question, if a new item or service required item or service is added, when do I have to begin covering that? And the general rule for most ACA items or services is basically for the first plan year beginning 1 year after the date that the item or services receives the required rating or recommendation. So I have a quick example here. If you have a calendar year health plan, you have to start covering the new ACA required preventive care items and services for the plan year beginning January 1, 2021, if that item or service received the requisite rating or recommendation on or before January 1, 2020. And as you might imagine, there's a significant lag there. And so if the federal government is going to force health plans to pay for COVID immunizations or COVID vaccines, we're going to have to significantly increase that lag time. And I think that is going to be where you see some of the burdens put on administrators of health plans, whether that be self-funded or fully insured. Just want to touch quickly on when a preventive care item or service is provided during an office visit and how you can bill for that office visit. Because there was a slight change. The federal government took the opportunity of issuing new regulations specific to COVID to bury in kind of a change in how these office visits are billed and paid for. So cost sharing for the office visit, separate from the required preventive care item or service, you can subject that to participant cost sharing when the participant the office visit is billed separately or is not the primary purpose of the office visit. So a few examples here is I go to an office visit to discuss abdominal pain, and I get a blood pressure screening. Blood pressure screening here is a required preventive care service. My primary care physician bills the blood pressure screening separately from the office visit. The group health plan can impose cost sharing on the actual office visit charge, but not, of course, the blood pressure screening. Second example, you assume the same facts, except my primary care physician does not bill my blood pressure screening separately from my office visit. In this situation, because I actually went to the provider's office to discuss my abdominal pain issues, which is not a required preventive care service, the group health plan can impose the normal participant cost sharing requirements on the whole charge, even though that includes a required preventive care item or service. Lastly, now let's just change the facts a little bit and say I go to the office visit for a blood pressure screening, but while I'm there, I discuss some abdominal pain that I've been having. And my primary care physician does not bill separately. In this situation, Even the health plan cannot impose participant cost sharing on any of the charge, whether that be the blood pressure screening or the office visit, because my primary reason for going to my doctor was to get the blood pressure screening, required preventive care item or service, and they didn't separate out the billing for the office visit for the discussion with respect to the abdominal pain. But again, that's going to be important for one little change we'll discuss here in a minute. So how does this preventive care mandate change with respect to the COVID vaccine? Well, this goes back to the CARES Act, which you probably remember was passed in March, and there were provisions that addressed the future of the COVID vaccine. And so first, it requires, again, non-grandfathered group health plans to cover on a first dollar basis what they call qualifying coronavirus preventive service, which is generally any item, service, or immunization. And with an immunization, it includes the administration of the immunization. So the actual process of getting what I see as being called the jab now, as long as that QCPS has a rating of A or B by the United States Preventive Service Task Force, or is recommended by the Advisory Committee on Immunization Practices. And please note that I did highlight that typically immunizations are only a required preventive service if they're for routine use. For coronavirus vaccines, at least during the public health emergency by HHS, those will be required even if they're not designated for routine use. New coronavirus preventive care services are all going to be new. We haven't had those before, so the biggest question is, when do I have to cover them? Remember, we had a significant delay, upwards of almost 2 years, for normal ACA-required preventive care services. But for coronavirus preventive care services that receive the A or B rating or the recommendation from the ACIP, we have to begin covering that on a first dollar basis within 15 business days. So that is, comparatively speaking, a very, very quick turnaround. So again, insurers and third-party administrators will need to really be on the ball with respect to updating their systems. Now, as Sarah pointed out, in theory, this requires very, very quick action on part of insurers and third-party administrators, but in reality, the coronavirus vaccination is not going to be available to large segments of the public for a significant period of time, likely much longer than 15 days. So in reality, even though we actually have the coverage mandate starts fairly quickly, actually providing the covered services may have some longer delays. Second, another big difference is, remember I said that typically with networked plans, you only have to provide the ACA-required preventive care items or services when provided by in-network providers. During the public health emergency, qualified coronavirus preventive services also have to be covered on a first dollar basis when provided by out-of-network providers. And the regulations say that when a plan reimburses an out-of-network provider who it presumably doesn't have a network agreement or a reimbursement agreement with, they must use a reasonable rate. And for an example of the reasonable rate, it gives the Medicare reimbursement rate. Now, one thing to keep in mind is that providers who get the vaccine for free from the federal government, which I suspect will be the vast majority of providers, they actually have to sign an agreement with the federal government in order to get that free vaccine that says that they will not balance bill or bill at all for the administration for the coronavirus. So they can bill plans, they can bill Medicare, they can bill Medicaid, they can bill private insurance plans, but once they get that reimbursement, they cannot then turn around and balance bill the patient. And if someone is uninsured, the provider actually has to administer that coronavirus vaccination for free of charge. So as I will point out, really what we're talking about here with respect to the plan's obligation to pay is in most cases will be the obligation to pay for the administration of the vaccine. Just to close things out, a few other comments. first of all, grandfathered group health plans, I know there's still some out there. There's not many, but those are not required to provide coverage for a coronavirus vaccine at all. Or if it does so, they're not required to provide it on a first dollar basis. So they can impose cost sharing requirements. Now, keep in mind, the federal government has still urged grandfathered group health plans to cover those, at least in some degree, to cover the vaccine in some degree. But also, please note that the CARES Act required all health and group health plans, grandfathered and non-grandfathered, to cover COVID diagnostic testing services during HHS's public health emergency. That does continue. So if you have a grandfathered health plan out there, you don't necessarily have to cover the vaccine, but at least during the public health emergency, which is currently scheduled to last through January 20 of 2021, you still have to provide COVID-19 diagnostic testing without any participant cost sharing. For those of you that have high deductible health plans out there and your participants are HSA eligible, the qualified coronavirus preventive services are all considered preventive services, so you can cover those before the satisfaction of the minimum high deductible or the minimum deductible under your high deductible health plan, and you will not jeopardize your participants' HSA eligibility. Again, another note, the vaccine is generally going to be paid for by the federal government. So as I pointed out before, in most cases, when it comes to a plan's obligation to pay, we're only talking about the administration of the vaccine. My next point goes back to why I wanted to explain the office visit allocation of participant cost sharing. These new regulations slipped in a new requirement that is going to last past the public health emergency, and basically says that cost sharing is not permissible for an item or service that's integral to the provision of that item or service, which may include an office visit. So for an example, is if I go for a diabetes screening, which is generally performed by a lab, the office visit, again, when not a preventive care service, is usually a required or an integral part for specimen collection in order for the lab to provide that diagnostic screening. So in this case, going back to my example, if my primary care physician if I went in to see my primary care physician for a diabetes screening, which is a required preventive care item or service, and my provider billed that service separately from the office visit, because that office visit was integral to collecting the information necessary to do that diagnostic screening, the plan could not impose cost sharing on the office visit in that example. And again, that is going to last past the public health emergency declared by HHS. So please note that most of the requirements, again, except for the one that I just spoke of, will automatically sunset when HHS's public health emergency expires. Again, that is currently set for January 20 of 2021. However, it has been extended several times, and I fully expect that it will be extended again. So we're probably looking, and if it's extended again, it will at least be for another 90 days. So we're probably looking at least until April, if not longer, before that expires. Now, keep in mind, if a coronavirus preventive services keeps its A or B rating by the USPSTF or keeps its recommendation by the ACIP, then it's likely still going to be a required preventive care service under the normal ACA mandate for preventive care items or services. But we expect more guidance on that issue soon or in the future. I think lastly, let's just talk about some considerations for employers who may not sponsor health plans or who may want to offer the vaccine to their employees outside of their health plan. So first of all, if you want to incentivize your employees to go get it, you get a cash, you likely can do that. I don't see that running afoul of any of the ACA or ERISA or Internal Revenue Code rules that apply to group health plans. That is likely going to be permissible, but you may want to talk about what those incentives are and whether HIPAA, non-discrimination, or other ADA considerations apply. And again, for those employers that potentially don't have health plans but want to pay for the cost and administration of the vaccine, I think that is largely going to be permissible, but you may want to discuss that with your legal advisor, because that could potentially create an ERISA group health plan, because the provision of a vaccine is considered medical care. But I think there are several arguments about that. And of course, if you inadvertently created a health plan, there's all kinds of other laws that would go along with that, that simply providing a vaccination service to your employees would not comply with. Again, I think there's ways to avoid that. We would model that typically how employers try to voluntarily offer influenza vaccines, but a good thing to discuss and have all of your ducks in a row before you offer that type of arrangement. And it looks like we don't have any additional questions. So Sarah,
now I should tell you, Tripp, that you're really good at this, because there were a few questions that got asked, but you answered them without even knowing that they had been asked. So
all right, good.
I bow to you.
Hopefully that people can understand me, because I was talking a little bit fast. I appreciate that, but I wanted to make sure I try to keep this to around an hour if possible.
Yeah, well, and I'm very grateful for Tripp to have this depth of knowledge on the benefit side of things. Whenever I hear him talk, I'm always thankful that he keeps track of all of this in his head so that I don't have to. So thank you all for joining today. And I know Tripp and I both hope you have a restful and safe weekend. And we will connect with you guys all again next week.
Thank you very much.